Good night, teacher. Well, sorry, I have problems. My laptop can record the screen out. The audio doesn't work on my phone, so this was the only way to record myself. So, well, okay. Um, Good night, teacher. I'm going to talk about physiotherapeutic evolution from. It's presented by Alison Sosa Duala. Well, physiotherapeutic evolution from. Well, and today, well, first I'm going to start speaking about index. Index is ID anamnesis, background, and evaluations, a clinic test, physiotherapy diagnostics, and treatment. Okay, first, like point number one, we have identification. Who is the person? Like name, age, date of birth, a marital status, file number, file number. So next we have anamnesis. Okay, anamnesis is part of the physiotherapeutic evaluation where information is collected thanks to a series of questions about the pathology such as reason for consultation, what he does, if the patient plays sports, any sports like football, for example, and among others. Okay, we are going to continue with story, a family pathological pharmacological. Ask him if he takes any medication. For example, surgical are important to be able to carry out a good treatment plan and okay, family, for example, for pathological pathology, like this. So we are going to continue with evaluation. Evaluation, like point number 4, perform a structural analysis. Here, the muscles, joints, tendons are evaluated, and within this point is what is the inspection. We have inspection. So inspection within we are going to evaluate the following. It would be the joint range, evaluation of muscle strength, assessing functional movements, and within this point is the trophies. We evaluate the trophies either by comparing it with the healthy side or with palpation that it's other way. This is one. No, sorry. This is done with the index and the index finger or thumb. Here we see if the patient has pain or palpation. Referral pain, well, pain when making a movement, but continuing with trophies. The most effective measure is measuring the muscle with a tape measure. It is in this way we obtain exact measurements. So we're going to continue with point number 5. That is 5, 6, and 7. That is test, diagnostic, and treatment. Okay. like point number 5, we have a specific test. We write down the test carried out with the goniometer, posture, gait, and also clinical test. And next we have the point number 6, diagnostics. It is the result of a clinical reasoning process that tends to identify the deficiencies, functional limitations, and abilities the patient, whether it is an alteration or a dysfunction. The next we have like point number 7, a treatment. Well, a set of means that are put into practice to treat a patient or pathology. So, to finish, as a conclusion, what is the relevance of carrying out the evaluation by the physiotherapist? Well, a good physiotherapy evaluation makes possible subsequent treatment much more effective, since the professional physiotherapist sets clear, specific, and achievable objectives so that they are fully adapted to the individual results of each patient. So it's all for today. I am going to finish to tell you thanks for this.